oftentimes when you do have a sciatica on the left side, it can be caused from some problems in the sigmoid colon, and specifically in a relationship to the sigmoid colon and the liver and spleen. So the relationship of like removal of toxins, waste, lymph, sort of like the immune system health of your gut down here, due to the balancing of that filtration system between the liver and the lower colon via the portal vein. So that's what this purple vein depicts, is the portal vein. So the portal vein especially relates to this balance between the two, and you can see all the yellow here, that would be the sacral plexus, even part of the lumbar plexus is going to be affected, especially when there is a blockage or a stagnation of flow or movement in that area. So a way you can check to see if the sigmoid colon is part of the sciatica is do a straight leg raise test, and then actually take your hand and just press down on that corner of the colon and press it towards your umbilicus, which is going to be like towards your belly button, right, towards L3. And that slacks, I don't know if you can see kind of the gray lines underneath, that slacks the mesocolon, which is like the ligamentous attachment of the sigmoid colon to the peritoneum. So the sigmoid colon is actually really mobile. It's one of the most mobile parts of the colon. So it is pretty easy to slide over. So if you slide it over, and you don't even have to know how to palpate the colon to do this, you can just imagine it's there and push the skin and all the tissue over towards the umbilicus, and then retest the straight leg raise. And if it changes, right, if it diminishes, chances are there is a relationship there. And then what you would do for treatment is I would treat around the liver, and I would treat in this area. And the easiest way to do is like with the Corgis ball, or with breath, or with the dynamic cups, where you can add in a skin lift. You can also do rotational stretches. A lot of this stuff I've already described for the liver, but I wanted to give you a visual here so you could see the anatomy, because once you see the anatomy, it's really clear how a sigmoid colon that's upset, perhaps maybe constipated, could create left-sided sciatica.